So I do want to be mindful of everyone's time, so I will go ahead and get us started. For those of you who don't know me, my name is Kristen Osterhout, and I am the Education and Training Coordinator for the Alzheimer's Disease Caregiver Support Initiative. We have a grant from the New York State Department of Health to provide services for caregivers in 6 counties. They are Clinton, Franklin, Essex, Warren, Washington, and Hamilton counties. And we do that through a variety of services. One being education and training. We are hosting a bunch of webinars right now and also available to meet with caregivers and their families in person at this time. We also have care consultations where you meet with a care navigator, either as an individual or as a family, and talk about your situation, and they can give you really individualized suggestions, things to try. They can connect you to resources depending on your particular situation. We have something called memory cafes. So on Wednesday, this upcoming Wednesday, we're doing one with Mitch Willett. He's a musical performer, so he will be playing guitar and singing. And this is a virtual event. Right now, we're still doing all of our memory cafes virtually. We also have a craft group, and that actually meets next week. So I deliver all of the supplies for everyone to do the craft, and then we get on Zoom together to do it. We do support groups. Those, again, are offered virtually at this time, although we are looking to return to in-person sometime this fall. Lastly, we do offer respite. So if you are a caregiver and you really don't get a break because you're doing your caregiving 24/7, we will help pay for you to get an occasional break through our respite program. We also have something called Project Lifesaver, which is a bracelet that your loved one would wear. And in the event they were to wander and you couldn't find them, you would work with the sheriff's department to locate them. All of our services are free. They're open to the public. So if anyone is interested in any of the upcoming events that I just mentioned, the support groups, the memory cafes, education and training, feel free to reach out to me. You all should have gotten an email from me to register for this event, or most of you did, or you can give me a call. My phone number is 518-564-2049. Again, that's 518-564-2049. And today I am here to talk to you about dementia. What does it mean? So we're actually going to start my presentation with a video. Oh, and before we do the video, I forgot to mention, you are in a listen only mode, so I cannot see or hear you. But if you have any questions, feel free to type them into the chat box, and I would be happy to answer them either as we go through the presentation and definitely if we have time at the end. So type your questions in the chat box if you have any.
What's the difference?
Hold on, I just want to fix the volume. There we go. Sorry about that.
What's the difference between Alzheimer's disease and dementia? Perhaps you've been confused by these terms in the past, or mistakenly thought they were the same thing. Well, you wouldn't be alone, because knowing the difference between Alzheimer's disease and dementia can be tricky, but it's actually not too hard to understand. In a nutshell, it's like the difference between shortness of breath and asthma. Shortness of breath is not a specific disease. It can have many different causes, and asthma is just one of them. Likewise, dementia is not one specific disease. It's a combination of symptoms that has many different causes, including Alzheimer's disease. Still sound a bit confusing? Okay, think of it like this. You go to your doctor with shortness of breath. To To find the cause, she listens to your chest to see if it's due to asthma or pneumonia. And then she checks your heart to see if your breathlessness is caused by heart failure or a very rapid heartbeat. She even asks if you've been worried in case your breathing difficulty is anxiety related. After her examinations, she concludes that your shortness of breath is actually a nut allergy. Similarly, when dealing with dementia, your doctor needs to figure out the underlying cause. And while Alzheimer's disease is the most common cause of dementia, it's not the only one. Dementia can also be caused by vascular changes in the brain, Parkinson's disease, Lewy body disease, vitamin deficiencies, thyroid gland problems, chronic brain infections, or medications. Even a very deep depression can sometimes look like dementia, which means if someone you love has dementia, it doesn't necessarily mean that they have Alzheimer's disease. And that's very important for your doctor to establish, because some causes of dementia, such as infection, medication reactions, an underactive thyroid gland, or vitamin deficiencies, can be reversible with the right treatment. So figuring out the cause and a plan of action could improve your quality of life. And that's why, if you or your loved one have the symptoms of dementia, you need to see your doctor to find out the underlying cause.
So just like that video showed us, dementia is the loss of thinking, remembering, and reasoning or cognitive functioning. There also is a decline in a person's behavioral abilities that affect their daily life. Everyone loses neurons in their brain as they age. However, people with dementia will lose these neurons at a much faster rate. Dementia is common as people get older, but it is not a normal part of aging. That's one of the biggest misconceptions I think there is about dementia. In order for a person to be diagnosed, they need to have 2 or more core mental functions impaired. So that would include things like their language, their memory, their visual perception, even their ability to focus and pay attention. The person must also have a loss of brain function that prevents them from doing everyday tasks, things like eating, bathing, dressing. The causes and symptoms of dementia can vary depending on the form of dementia that a person has. I also think it's important to say that not everyone is going to have all of the symptoms that are associated with one type of dementia. Every situation is very individualized. Just like we saw in the video, there are some medical conditions that can resemble dementia. And once that condition is found and treated, the memory problems will go away. So that would include things like normal pressure hydrocephalus, which is the buildup of fluid in the brain, side effects of medications, depression, some vitamin deficiencies, drinking too much alcohol, brain tumors, head injuries, thyroid, kidney, or liver problems. On the other hand, it could be something called a neurodegenerative disorder, to which there are no cures. They cause progressive, irreversible decline in memory and behavioral abilities. Medication can help slow the disease for some types of dementia. However, they cannot stop the disease or help the person get back what has already been lost. So the types of dementia that we're going to talk about today are Alzheimer's disease, frontotemporal dementia, Lewy body dementia, vascular dementia, and mixed dementia. These are the most common types. A lot of people will ask me what is the difference between dementia and old age. So suffering from some of the forms of dementia, some of the symptoms of dementia, such as decreased focus, lack of motivation, decreased memory, does not always mean you have dementia. These could be normal signs of aging or even depression. One of the biggest differences between aging and dementia is the rate of the decline. With normal aging, the mental decline is more slow and gradual, whereas with dementia, it could happen very suddenly. Speech skills, forgetting a word here or there can be a sign of normal aging, whereas having frequent pauses in speech, calling things by the wrong name, or having a hard time understanding speech could be a sign of dementia. Memory loss. I mean, you and I, we can all think of times where we've forgotten something. With dementia-related memory loss, a person might not even remember the times that they've forgotten something, and they may not acknowledge it unless they're asked. Short-term memory changes, like the inability to remember recent conversations or events, are also not a normal sign of aging. And trouble with familiar tasks. It can be normal to have a hard time learning a new skill. If someone is having trouble with something they're familiar with, let's say they're getting lost in their neighborhood, that could be a sign of dementia. Social skills. Losing social skills are not a normal part of aging. Some changes in social skills that could indicate dementia include decreased interest in socializing, the ability to speak to others, or an increase in socially inappropriate behaviors, maybe laughing at a time when it's just not appropriate to laugh. The signs and symptoms of dementia can vary from person to person, and the severity of it depends on the type of dementia that they have. So it's really important to keep in mind. On the other hand, some normal aging symptoms include slower recall speed, decreased problem-solving abilities, slower reaction time, decreased attention span, decreased concentration, and decreased learning speed. So how is dementia diagnosed? When dementia symptoms first appear, doctors are going to look to see if there's another cause to rule out, such as depression, vitamin deficiency, or normal pressure hydrocephalus. Ruling out these reversible dementias first is one of the reasons why early diagnosis is so important. Then that would follow a medical assessment, which might include patient history. Usually the doctor will go over their medical history as well as family history. They might ask if anyone in the family has dementia. They also want to know when the symptoms started, if there have been any behavior or personality changes. And they'll go over the medications that you're taking as well to help rule that out as a possibility. A physical exam, just like a regular physical, the doctor will take your vitals, including your blood pressure, as this can help rule out some other conditions that could be causing the dementia or the memory loss, and they could be treatable. Then they might do a neurological test. They'll look at things like your balance, your reflexes, your vision and eye movements, and sensory functions to rule out any other conditions. Cognitive and neuropsychological tests will test a person's memory, problem-solving skills, attention, language, as well as other skills related to mental functioning. And these are usually simple pen and paper tests. They'll ask you to draw, write, or maybe remember 5 words. Lab tests, blood and urine tests can help rule out other possibilities. And then a doctor might choose to do a brain scan, although not always. These can let doctors see if there have been any strokes or tumors or other problems in the brain that could cause the dementia. They can also look for changes in the brain structure or function. The most common scans are CT scans, MRIs, and PET scans. They'll also do a psychiatric evaluation to rule out depression. And sometimes you may opt to do a genetic test, although some forms of dementia are caused by genetic defect, but not most of them are not actually genetic. Now we're going to talk about some of the different types of dementia. So we're going to start with Alzheimer's disease. And I have another short video about Alzheimer's.
What is Alzheimer's disease? Alzheimer's is a slow, fatal disease of the brain affecting 1 in 10 people over the age of 65. No one is immune. The disease comes on gradually as 2 abnormal protein fragments called plaques and tangles accumulate in the brain and kill brain cells. They start here in the hippocampus, the part of the brain where memories are first formed. Over many years' time, the plaques and tangles slowly destroy the hippocampus, and it becomes harder and harder to form new memories. Simple recollections from a few hours or days ago that the rest of us might take for granted are just not there. After that, more plaques and tangles spread into different regions of the brain, killing cells and compromising function wherever they go. This spreading around is what causes the different stages of Alzheimer's. From the hippocampus, the disease spreads here to the region of the brain where language is processed. When that happens, it gets tougher and tougher to find the right word. Next, the disease creeps toward the front of the brain, where logical thought takes place. Very gradually, a person begins to lose the ability to solve problems, grasp concepts, and make plans. Next, the plaques and tangles invade the part of the brain where emotions are regulated. When this happens, the patient gradually loses control over moods and feelings. After that, the disease moves to where the brain makes sense of things it sees, hears, and smells. In this stage, Alzheimer's wreaks havoc on a person's senses and can spark hallucinations. Eventually, the plaques and tangles erase a person's oldest and most precious memories, which are stored here in the back of the brain. Near the end, the disease compromises a person's balance and coordination. And in the very last stage, it destroys the part of the brain that regulates breathing and the heart. The progression from mild forgetting to death is slow and steady and takes place over an average of 8 to 10 years. It is relentless and, for now, incurable. Helping your family, friends, and neighbors to better understand Alzheimer's will reduce stigma, improve care, and even help the fight for a cure. Thanks for helping to do your part. Learn more at www.aboutalz.org.
Alzheimer's disease is the most common form of dementia found among older adults. It's a progressive, irreversible brain disorder that slowly destroys a person's memory and thinking skills. Most people will show their symptoms in their 60s, and this is called late onset. However, symptoms can occur as early as a person's 30s, and this is rare, but it's called early onset. Alzheimer's disease is caused by the buildup of plaque and tangles in the brain, along with the loss of connections between nerve cells or neurons in the brain. These neurons send messages between the brain and other parts of the body. It's estimated that more than 5 million Americans have Alzheimer's disease, and it's expected that that number will grow as the baby boomer generation continues to age, unless a cure or a treatment is found. The amount of time a person can live with Alzheimer's disease varies from person to person. For some people, it's as little as 3 to 4 years, while others, it could be as long as 10 or even 20 years. The cause of Alzheimer's disease is still unknown. Age is the #1 risk factor for Alzheimer's. 1 in 10 people over the age of 65 have Alzheimer's. And once a person reaches 85, the odds jump up to 1 in 3. Scientists believe that when it comes to late onset, a combination of genes, lifestyle, and environment all play a role in developing the disease. Genes with late onset Alzheimer's disease, there may be a specific link between a gene on one of the chromosomes that seems to increase a person's risk. However, having this gene doesn't mean that the person necessarily will develop Alzheimer's or not. Plenty of people have the gene and don't get Alzheimer's, and vice versa. In some cases, early onset does tend to be a little more genetically related. If a person carries that gene, then they have a 50-50 chance of having it themselves. If they do inherit, then they are more likely to develop early onset familial Alzheimer's disease. also believe that there's a connection between Alzheimer's disease and vascular conditions such as heart disease, stroke, and high blood pressure. They also believe that there's a connection between Alzheimer's disease and diabetes and obesity. Due to its complexity, it usually takes several medications or interventions to help with some of the symptoms of Alzheimer's disease. Medications work best for people who are in the early to moderate stages of Alzheimer's. It's important to remember that no medication is going to stop the disease from progressing. However, it can slow some of the symptoms down, which allows the person to live on their own longer or help their caregiver with managing some of their symptoms. When doctors start a person on a new medication, they usually start them out at a low dose to see how the person does. They will then start to increase the dosage based on how the person reacts. Usually the higher the dose, the more likely there is to be side effects. As with any medications, doctors should be kept well informed. There are side effects from the medications or changes in other medications that the person is taking, including over-the-counter medications. Some of the behaviors that a person with Alzheimer's might start to develop can be managed through medication as well. But trying to manage some of the behaviors without medication can be beneficial to both the person living with Alzheimer's and the caregiver. One thing that I think is really important is to join the world of the person with Alzheimer's disease and really pick and choose your battles. You don't have to correct them necessarily all of the time, but really join their world instead of arguing with them. Vascular dementia, this is my last video.
What is vascular dementia? Vascular dementia is the second most common type of dementia. It is caused by problems with the blood supply to the brain. Nerve cells require oxygen and nutrients to survive. Without them, they will become damaged or die. Cells are provided with oxygen and nutrients by a network of blood vessels in the brain. When the blood supply to the brain is interrupted, for example, by a sudden blockage or a leak, this is called a stroke. A stroke can cause significant damage to parts of the brain. When the parts of the brain responsible for memory, thinking, or language are damaged in this way, a person will have difficulty remembering things, thinking, or speaking. These are all symptoms of vascular dementia. Sometimes, a single large stroke is enough to cause the symptoms of dementia. This is known as post-stroke dementia. This scan shows damage to the brain of someone with post-stroke dementia. In other cases, a person may experience a series of smaller strokes that gradually cause damage. This is known as multi-infarct dementia. Following a stroke, a person's symptoms may remain constant for a while. Then, if the person has another stroke, they may notice a sudden worsening of symptoms. This is known as a step-like progression. Small vessel disease is where there is a narrowing of the blood vessels deep in the brain. Small vessel disease is the most common cause of vascular dementia. As the narrowing affects more small blood vessels, and more of the brain becomes damaged, the person will experience a gradual loss of abilities. Usually, people with small vessel disease notice a slowing of thinking and problem solving. For example, taking longer to think of a word and write it down. Evidence suggests that lifestyle factors that promote a healthy blood supply, such as regular exercise, not smoking, and eating a healthy diet, could help to reduce the risk of vascular dementia. There is currently no cure for vascular dementia. However, by controlling underlying cardiovascular diseases which affect the blood supply, such as high blood pressure, high cholesterol, and heart disease, it may be possible to slow down the progression of the condition. Vascular dementia will affect people differently, depending on the parts of the brain that are affected. However, a common symptom is having problems with planning and organising, or with concentrating. It can help to break complex tasks down into smaller steps and to make sure that environments are not too busy or noisy.
So vascular dementia is the second most common form of dementia, and researchers do believe that vascular dementia is actually underdiagnosed. It occurs when there's damage to the blood vessels that carry blood to the brain, are damaged or blocked, depriving the brain of nutrients and oxygen. This is caused by a stroke. If the stroke is large, then the symptoms will be noticeable right away. However, if the person has several mini strokes, then changes in memory and thinking are likely to be more gradual. The changes in the brain areas that are responsible for storing and retrieving information could cause memory loss that makes vascular dementia look a lot like Alzheimer's. Vascular dementia often exists with other forms of dementia, such as Alzheimer's or Lewy body dementia. Because it depends on what part of the brain is affected by the blood vessel damage, the symptoms of vascular dementia can vary. The changes in memory may or may not be significant. Usually, the symptoms of vascular dementia are most noticeable right after the stroke. The symptoms of vascular dementia could happen at the same time as the well-known stroke symptoms, such as a sudden headache, difficulty walking, numbness, or paralysis on one side of the body. Whereas with the mini strokes, the symptoms may not be noticeable right away, and there could be a more gradual change in thinking and memory that leads to poor planning and judgment, uncontrolled laughing or crying, decreased attention span, decreased functioning in social situations, and difficulty finding the right word. Usually, vascular dementia is treated with medication to help prevent strokes. The thought behind this is to minimize the risk of the stroke and reduce the amount of brain damage. Medications can be used to help manage some of the other risk factors as well. There are some studies that indicate that the medications for Alzheimer's disease could also help with memory loss in the beginning stages of vascular dementia. And we're going to talk about dementia with Lewy bodies. This is the third most common form of dementia. Actually, Robin Williams had Lewy body dementia, and it is caused by an abnormal protein that deposits in the brain called Lewy bodies. So it's just a different protein that deposits instead of the plaque and the tangles that built up with Alzheimer's disease. Lewy bodies affect the chemicals in the brain and can lead to problems with thinking, behavior, movement, and mood. It's a progressive form of dementia, and the average time from diagnosis to death is 5 to 7 years. The rate at which the symptoms develop varies depending on overall health, age, and severity of the symptoms. There are two forms of Lewy body dementia: Lewy body with dementia and Parkinson's disease with dementia. At the beginning, these could look like two separate diseases. However, as they progress, they could have very similar symptoms. During the early stages of Lewy body dementia, a person can live a fairly normal life. However, as the disease progresses, the person with Lewy body dementia will require more help due to the decline in movement and thinking. In the late stages, the person could depend entirely on others for care. Treatments for the symptoms may work for a while. However, there is no cure at this time. So some of the symptoms, and again, I want to remind you that just because these are symptoms that your loved one could experience, if they are diagnosed with Lewy body dementia, it doesn't mean that they're going to experience all of these symptoms. So they really do vary from person to person and in severity too. Some of the cognitive symptoms include dementia. This primary symptom typically includes problems with visual and perception, planning, problem solving, and reasoning. Cognitive fluctuations. The person doesn't seem to have the same concentration or alertness, attentiveness from day to day. They could seem lethargic or sleepy, even though they got plenty of rest the night before. The person may also have difficulty with their thoughts, or they come out unclear, disorganized, or illogical. Hallucinations. When people see or hear things that aren't there, people with Lewy body dementia are more likely to have visual hallucinations, and they are likely to be early on in the disease. Often these hallucinations will include children or animals. They're very realistic and detailed. As long as the hallucinations aren't causing the person harm, such as scaring them or causing them to do dangerous things, treatment is often not needed. So that's one of those things, like I was mentioning before with Alzheimer's disease, in that section, where you need to join their world, join their reality. So if your loved one says to you, oh, the grandkids came over today and we baked cookies, but we were out of chocolate chips, so we had to make sugar cookies. And they go into this whole detailed story about the grandkids. And you're like, there's no way, the grandkids live across the country. They didn't come for a visit today. Just go along with it. There's no harm in that. Whereas if it was causing them, maybe it's a more sinister hallucination, they're worried that someone's out to get them, that's when you step in and say, well, I'm here, I'm going to protect you, I'll call the police if someone does come and break into our house or tries to get you. Movement symptoms. One of the early movement symptoms that can be associated with Lewy body dementia is actually seen in their handwriting. If there's a big change in their handwriting, that's not something you want to overlook. Some of the other symptoms include muscle stiffness, shuffling walk, a tremor, or shaking, balance problems, stooped posture, loss of coordination, reduced facial expression, difficulty swallowing, or a weak voice. Sleep problems are also very, very common with people with Lewy body dementia, but they often go undiagnosed. Sometimes they go to see a sleep specialist who can help with diagnosis and treatment. REM sleep disorder is when a person is acting out their dreams. It could include talking in their sleep, violent movements, or even falling out of bed. REM sleep disorder can occur in the person years before any other symptoms of Lewy body dementia, and sometimes they're only noticed by the person's spouse. Excessive daytime sleepiness, sleeping for more than 2 hours during the day. Insomnia, having difficulty falling or staying asleep. And restless leg syndrome, when a person, usually while resting, has the urge to move their legs in order to stop an unpleasant or unusual feeling in their legs. The last type of symptoms I want to talk about are behavioral and mood symptoms. These include things like depression, apathy, or the lack of interest in day-to-day activities, anxiety, agitation, delusions, when a person strongly believes or has an opinion that's not based in fact, or paranoia and irrational distrust of other people. The exact cause of Lewy body dementia is still unknown. However, there are a few things that researchers believe to be risk factors. Age. People who have Lewy body dementia most of the time are over the age of 50. Diseases and health conditions, Parkinson's disease and REM sleep disorder put a person at a higher risk for developing Lewy body dementia. Genetics. Lewy body is not considered a genetic disease. However, it could increase a person's risk if he or she has a family member with the disease. And lifestyle. There's no one piece of a person's lifestyle that seems to increase the chances of forming the disease. However, researchers believe that having a healthy lifestyle can reduce the chances. At this time, Lewy body dementia can't be cured, but some of the symptoms may respond to treatment for a limited period of time. Building a care team can be beneficial to both the person with Lewy body dementia and the caregivers. The care team should include a neurologist specializing in dementia, physical therapists, speech therapists, occupational therapists, Mental health counselors and music or expressive arts therapists could also include a team of family and friends to help support the caregiver and the person living with dementia. Support groups could also be beneficial to both the patient and the caregiver, as they can talk to others who are in a similar situation. Medications used for Alzheimer's disease can be effective for people with Lewy body dementia. These can be used for some of the cognitive Lewy body symptoms. The movement symptoms associated with Lewy body dementia can be treated with some Parkinson's medications. However, there are some potential side effects. And since the lack of sleep can increase the confusion and behavioral problems in the person living with Lewy body dementia, it's important to make sure they get the best night's sleep they can. Problems with sleep can be treated with medication. However, sometimes increasing or changing a person's activities during the day can help greatly with their quality of sleep. A doctor may order a sleep study to evaluate what the cause of sleep disturbance is and what the best course of treatment is. One of the hardest things for caregivers of a person living with Lewy body dementia are the hallucinations and the delusions. While these can be managed through medication, it's important to think about if the hallucinations or delusions are hurting anyone and how much distress they're causing the person. The person may not understand that the hallucinations are not real and can cause them to become scared or anxious. Caregivers can help by acknowledging the person's fear and offering empathy. The behavioral problems may not just be from hallucinations. The person can be experiencing pain or illness. They're simply unable to express how they're feeling. Antidepressants can be well tolerated by people with Lewy body dementia. However, other antipsychotic medications should be used with caution, as they can have severe side effects and make movement issues worse. Now, the last main type of dementia that we're going to talk about is frontal temporal dementia. This is a form of dementia when there's brain damage to the nerves in the frontal and temporal lobes of the brain. So right here by the forehead and over by the ears. While these nerves die, the lobes start to shrink, and this begins to cause changes in thinking and behaviors. The damage can either start in the frontal or the temporal lobes, and depending on where it starts will affect what type of symptoms you see at first. The frontal lobe is responsible for planning, prioritizing, multitasking, looking, and fixing errors. The temporal lobe on the sides are responsible for memory, language, and emotions. This form of dementia usually affects people between the ages of 45 and 64 years old. And there's currently no cure or treatments to slow or stop frontotemporal dementia. Once a person is diagnosed, life expectancy is typically up to 10 years. Symptoms really do vary from person to person, and depending, like I said before, on which lobe is affected first. Behavioral symptoms could include changes with planning, remembering which step comes first, then next, changes with prioritizing, compulsive eating or doing an activity or saying the same word over and over again, or difficulty resisting the impulse to use or touch things when they see them. For example, picking up a pen off the table with even though they have no intention of writing or using it. Also, a person may do things without thought of how it affects others around them. For example, laughing when it's not appropriate or making noises during a meeting. A person may start to have difficulty with using or understanding words, but can physically say them, or they can understand the words but have difficulty saying them. For example, slurring when they talk. A person may have difficulty starting a project, or they might be able to participate if someone else does all of the planning and has all of the supplies ready for them. And their emotions could be disconnected from the situation or expressed at the wrong time. For example, laughing in a sad situation. They may begin to have a difficult time reading social cues from people around them, or lack the ability to understand how others are feeling. They could begin to shuffle when they walk, have tremors, have unusual postures with their body parts, such as their hands and feet. They might have trouble using a knife and fork, or they might become clumsy. Researchers are like all the other forms of dementia. I feel like a broken record by this point in my presentation, but researchers are still unsure of what causes frontotemporal dementia. Unlike other dementias, aging is not one of the biggest risk factors, as it tends to affect people who are under the age of 65. However, they believe it's caused by the lack of neurons and plaque buildup in the frontal and temporal areas of the brain, causing damage or shrinkage of those lobes. And again, there's no treatment or cure to prevent frontotemporal dementia. One way to try to make things easier for the patient and the caregiver is to try to manage some of the symptoms. So behavior management can be difficult for the caregiver because they need to accept rather than challenge the person living with frontotemporal dementia. This means not arguing or trying to reason with the person because they're truly unable to control their behaviors, and they cannot see that what they're doing is upsetting to others. It can help keep things less confusing by having a routine and by giving two choices when asking a person what they would like to do rather than leaving it open-ended. Medications can be used to help treat some of the behaviors, but be aware of side effects too. Language can decline over time. It's important to try to maintain language that is still there, find other ways to communicate when speaking isn't possible. The use of a communication notebook could be helpful when people are no longer able to speak, but they are still able to write things down. Sometimes working with a speech and language pathologist can help determine the best tools to use. Physical and occupational therapy can also be helpful for someone with movement symptoms due to frontotemporal dementia. In some cases, medication that's used for Parkinson's disease can be helpful. However, no treatment can slow down or stop movement disorders caused by frontotemporal dementia. What is mixed dementia? Mixed dementia is when a person has two or more forms of dementia. There are some studies that show this is actually the most common form of dementia in the elderly. When it comes to mixed dementia, the most common seems to be Alzheimer's disease and vascular dementia. However, it's been seen as Alzheimer's and Lewy body dementia too. A study that was done found that 40% of autopsies done with a person who was thought just to have Alzheimer's, they found signs of stroke or other vascular diseases, and the risk factors for Alzheimer's disease and vascular dementia seem to be the same. It's unclear if a person's brain shows symptoms of two or more types of dementia form worse or more symptoms. And this is the question that everyone asks me. How can I lower my risk? Again, aging is the biggest risk factor for dementia, and there's nothing we can do about that. Everyone's getting older every single day. However, there are some things that we can do to control or help reduce our risk for dementia. So if you're a smoker, quit. Manage your blood pressure, your cholesterol, and your blood sugar. Eat a healthy, balanced diet and exercise regularly. Maintain a healthy weight. Limit alcohol, and protect your head from concussions. So that brings me to the end of my presentation. If you have any questions, feel free to type them into the chat box now. And I will wait a few moments just to see if any questions come in. While I'm waiting, I know I mentioned in my email, I don't know, there we go. But I normally do this presentation in person, and I give out a copy of this book, Understanding Alzheimer's. So if you would like a copy of this book, I'd be happy to give it out to you for free. All you have to do is get a hold of me, either in the chat box or give me a call or send me an email. And I will either mail this or drop this off to you sometime in the next few weeks. So that's available. I also want to let you know that this is part of a 6-week series. So next week, I will be doing another presentation on advanced directives and financial planning. And I will be doing that with Kim Hans from the Herzog Law Firm. So if that is something you're interested in, I'm sure you all will be on my email list. So be sure to sign up for that. Okay, well, if there are no questions, I want, oh, one just came in. Okay. Yes, I would be happy. It's just about the book. I'd be happy to get you a copy of the book. Let me write that down. Thank you all so much for attending this presentation today on dementia. What does it mean? I hope to see you all soon at one of our other upcoming events.